Okay, everybody. Mm, Can everybody see this okay?
Yeah.
All right. A lot of people that I've talked to have talked about kidney disease, and I know I've had some people in my family that it has run in their families, meaning the parents had kidney disease and the child, but it really is not hereditary. Um, but we're going to talk about kidney disease. We're going to talk about kidney cancer. We're going to also talk about kidney stones. So those things are, and they all come about from, again, the kind of diet that we have. So let's get into the lesson for today. Um, as as usual, I like to start the lesson off with thinking outside the box. Um, but before I get into that, did everybody hear about? Did everybody hear what the governor did today?
Yes.
I did.
Okay. Did everybody? Not, some people didn't hear. Where
Mhm.
he released over 100,000, um, mostly
Oh, yeah.
mostly black
Oh,
men that had um, charges of possession of marijuana, and he released them all today.
175,000.
Yeah,
Oh
Yes.
that
yeah.
that is
I
God.
that is that is
God.
groundbreaking.
Mm-hmm.
So
That's
we,
wonderful.
yeah, he's a good governor.
Hello?
We'll
Hello?
probably hello. We're probably
Just wanted
going.
to make sure y'all.
Everybody should be on mute. Okay, but he's probably going to be a candidate for president very soon. If not after this term, he's probably going to give Vice President Harris a run for her money for his for Democratic nomination. So look out for him. All right, getting back to Tyrone's motto: eat for nutrition, not for taste. However, you can make nutritional foods taste good. Now, how many people are starting to make some transition and talk about and think about um, healthy eating as a way to get off some medication, a way to reduce their numbers?
excuse me, Mr. Qualls. We're not seeing your whole slide. We're seeing your notes too.
Oh, okay. Well, let me do this. Okay.
That's good.
What can you see now?
Just your note, just your slide, which is good.
Can you see just the slide now?
Yes.
Okay. All right. Very good. Okay. the question for a lot of people sometimes is, where are your kidneys? Your kidneys are located in the upper region of your abdomen, behind your stomach, and just below your rib cage. One on one side and one on the other side of your spine. They are bean-like shaped organs, each with about the size of your fist. And the color is kind of a purplish brown color. And I'm going to actually show you a real kidney a little later on. Kidneys are part of your urinating tract, which also includes your urethra and your bladder. Okay, what do the kidneys do? You know, I thought about this with that commercial. The little girl was talking about the dishwasher. She said, "And what does the dishwasher do?" So I always like to say, okay, well, what does the kidney do? You have two kidneys. They are bean-like shaped organs that are located toward your back on either side of your spine, just under your rib cage. Each is about the size of your fist. Your kidneys has many jobs, but the main job is to clean your blood, getting rid of toxins, waste, and excess water as urine. Your kidneys are also balance the amount of electrolytes such as salt and potassium and minerals in your body, make hormones that control blood pressure, make red blood cells. Now, a lot of people didn't know that your kidneys help control your blood pressure. Interesting. Keep your bones strong. If your kidneys are not damaged and don't work as they should, waste can build up in your blood and make you sick. Okay. The top five jobs that what a kidney does, and this is a good picture of your kidneys, and you can see unfiltered blood comes in, and then it's filtered through your kidneys, and then it's filtered and goes back out through this, and this is the blue one here. And then you have your urethra down here, and your urine goes into your bladder. Okay, what is chronic kidney disease? Or they call it CKD. Is a long-term condition that occurs when the kidneys when your kidneys gradually lose function over time, making it difficult for them to filter blood properly. This damage can cause waste to build up in the body, which can lead to other health issues such as a heart disease or a stroke. CKD, this chronic kidney disease, is often associated with aging, but can affect anyone, and is more common in people of Black or Southern Asian descent. It's estimated that about 1 in 7 have CKD, but most of them don't even know it. And it's just like diabetes or pre-diabetes, a lot of, and high blood pressure. We have these conditions, and most people of color don't. And that's one of the reasons why I like to try to do these. So just to enlighten you, I'm not trying to be a doctor and tell you, use these kind of medications. I'm just trying to give you some basic knowledge of different organs and different chronic conditions. Okay. Let me get back to symptoms of CKD develop slowly and aren't specific to disease, and some some people may have symptoms and so, or no, may not have any symptoms at all. Symptoms can include changes in urine, swelling, fatigue, skin rash or itching, metallic taste in your mouth or smell like ammonia on your breath, nausea and vomiting, and shortness of breath. And here you can see what it can, again, what the kidney looks like and the way it filters blood. This is starting to be a diseased kidney. You can see it's starting to look rugged and diseased. Symptoms of chronic kidney disease: dry and itchy skin, tiredness and weakness, bubbling or foamy in your pee, swelling of your hands and your ankles and feet, puffy eyes, terrible sleeping. You have bad sleeping habits. You have problem sleeping, loss of appetite, muscle cramps, a need to pee often. Okay, the 5 stages of kidney disease. There are 5 stages of chronic kidney disease. The stages are based on how well your kidneys are able to filter out waste from your blood. Blood and urine test determine which of the CKD you're in. The stages range from very mild to stay in stage 1 to kidney failure, which is in stage 5. Health care providers determine the stage your kidney function according to your GFR rating. Your GFR is a number based on the number of ketones or waste product found in your blood. Okay, stage 1. Your kidneys are working well, but have signs of mild kidney damage, as you can see here. Stage 2, your kidneys are working well, but you have more signs of mild kidney damage, as you can see here. Stage 3. Your kidneys are working well, but have moderate loss of functions. Stage 4. You have very poor kidney function. Your kidneys are severely damaged and close to not working. And then last but not least, stage 5. Your kidneys are very close to failing and have stopped working. You may have to need to do dialysis or you may need to have a kidney transplant. Okay. Any questions so far about your kidneys? Okay.
Hey, Ty, it's Craig.
Hey, Craig.
Can you hear me okay?
I can hear you okay.
I'm sorry. I'm on my cell phone, but just more of a comment when it talks to kidneys and renal failure. So that's what you're referring to, right?
Yes.
Renal failure?
Yeah, that's the other word for it. Another definite use is called renal failure. Yes. Same thing.
Okay, because I actually had a brother I was stationed with, and his mother went into renal failure. They told her that if you kept drinking sodas, your kidneys would fail, and the sodas were so addictive, she just couldn't stop drinking sodas.
Yeah. Soda,
And
soda.
I didn't realize how addictive that was.
Oh yeah, well, soda's loaded with sugar, and that's an addiction. You know, sugar, but naturally, alcohol but sodas and dairy have a great impact on your kidneys, and um, you don't want to be, and that's why I'm always talking about, uh, uh, ditch the dairy, get away from dairy, but also sodas. We need to move away from drinking sodas. I don't, whether they're diet sodas or whether they're just regular sodas. But
Hello.
thanks for bringing that up, Craig. A lot of people don't realize that sodas are one of the risk factors for kidney disease. Somebody else have the
Well,
question?
yeah, and it was so bad that she actually couldn't. She passed away from it, but she just couldn't give up the sodas.
Yeah.
I mean, so anyway, that was just a comment.
Now, thank you for that comment, but unfortunately, people with a lot of addictions just sometimes cannot stop. And you would think, sodas, but the sugar in sodas is just like a cocaine addiction. Okay.
Tyrone.
Yes.
This is Marilyn. What is this? Go ahead. Hello, Mr. Tyrone. Hello,
Hello, Marilyn.
classmates.
Go ahead.
What is renal cell cancer? Is that
That's the
falls in
same.
with this also?
Yeah. Renal failure is the same thing as kidney disease, and renal cell cancer is the same thing as kidney cancer, basically. That's what's on the screen. Kidney cancer is a type of cancer that starts in the kidney when the cells in the body begin to grow out of control. As more cancer cells develop, they can form a tumor, and with time may spread to other parts of the body. And that's when you have kidney cancer, and if it stays within that one kidney, then you can do a kidney transplant. Somebody else have a question? Okay. What are some of the common causes of kidney disease? Diabetes, type 1 and type 2 are common causes. Having high blood pressure, having kidneys that become functional as you age. And sometimes that if you've been drinking a lot of sodas, or if you have an unhealthy eating lifestyle, then sometime eventually you're going to have a kidney problem. Infections that directly injure your kidneys. Blockages like kidney stones and other blockages that can cause kidney disease. We're going to talk about kidney stones in a few minutes. Medications. Some medications can cause kidney disease. Now, if you're getting medication from your doctor for whatever it is, you always want to make sure you read the side effects, whatever the side effects are.
Mm-hmm. That's the truth.
Okay. All right. Other medical conditions. You have heart disease, obesity, and pregnancy complications can also increase the risk of kidney disease. And autoimmune conditions such as lupus, IgA neuropathy are autoimmune diseases that increase the risk of kidney disease. So there are a lot of different things that can keep your blood from being filtered and cleaned up. So you got to just But most of these things can be cured or prevented by changing what you're putting in your body. Bottom line. Now, this is what your kidney looks like. It's kind of a purplish or brownish color. It looks
Excuse
almost.
me, Tyrone.
Yes.
You froze for a minute. So can you go back and
Oh, did I
describe
forget?
those conditions,
Oh, sure. Okay.
please, and thank you.
No problem. No problem. Okay. Going back over the causes: diabetes, type 1 and type 2, high blood pressure, aging of your kidneys, infections, blockages such as kidney stones. And we're going to get into showing you how you get kidney stones and what they look like. Some medications can cause kidney stones. And what I was saying is, if certain medications have tremendous side effects, and you may want to make sure that you are reading, or your doctor is telling you what are the side effects of the medications that you're on. And other medical conditions, heart disease, obesity, and some pregnancy complications can lead to it. And autoimmune conditions such as lupus and IgA neuropathy are autoimmune diseases that increase the risk of kidney diseases. And this is kind of what it can look like. Diabetic kidney disease. Okay, now what I was showing was back to this. This is actually what your kidneys look like inside your body, the right and the left. So it exists. It's sort of a purplish, brownish color, and but for some people, it's about the size of their fist. For some people, it's a little bigger. Okay, what are kidney stones? Now you can see here stones that will clog in your urethra and also in your bladder. Whoops. Kidney stones here. See where stones can be. They're in your kidney, almost starting to come out of your kidney, and also in your urethra. Kidney stones are hard deposits made of minerals and salts. Like I said, most people don't know what kidney stones are made out of, or how they look, or how you get them. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. Diet, as I said, is a bad diet. Excess body weight, obesity, being overweight, some medical conditions, certain supplements and medications are among the causes of kidney stones. Kidney stones can affect any part of your urinary tract from your kidneys to your bladder. And that's what this is showing. Often stones form from the urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be quite painful. And if you know anybody, and my sister can attest to, our father, years before he passed, he developed kidney stones. He had to have an emergency operation to get his kidney stones out. He could not pass them. Passing kidney stone be quite painful, but the stones usually cause no permanent damage if they are recognized in a timely fashion. So if not, they don't hurt. You just need to get them out. because they say they can be just very painful and you get pain in your right in your stomach or in your kidneys and your bladder.
Tyrone, I have a question.
Sure.
It was like maybe 20, maybe 30 years ago. And a doctor told me that I had kidney stones, right? And my primary care doctor, right? And they sent me to a doctor, right? And he didn't look at anything. He just was gonna just give me a date for surgery. I was like, you hadn't even looked at me. I never went back, and I never had any problems. But he said, well, if it passes, it's gonna be real painful. I said, well, I'll take that chance. But I didn't never go back. I never heard anybody else say, and listen, it passed on its own or whatever, because they
Right.
can't pass on their own without causing problems, right?
Right. Exactly. Yeah. Sometimes it and you can drink a lot of water, or sometimes medication will help them. And depending on the size, some people can pass them. And once you pass them, if they go through, actually, they come out in your bladder, and your if you pass them, then you're okay. But some people can't.
Yeah, I never went back to him.
Can
Okay.
I add, Mr. Tyrone? Depends on the size. Depends on the size and what area in the kidneys they are. For some,
Exactly.
they can break up and they can break up into small crystals and you pass them. For other people, they are larger and they get lodged in the urethra or the collecting ducts, causing a complete obstruction.
Right.
And then I also wanted to say there are stages of CKD. All CKD is not renal failure. It means that that the kidneys, there's impaired function. So you have renal failure, which is when you've gotten to CKD, past CKD3, CKD.
4 and 5.
They no longer, right, they no longer function.
Right.
But it doesn't necessarily mean that they fail. But if you don't do something in time, then they probably are going to fail. And the most common causes of renal failure are CKD, renal failure in general, is generally hypertension that is uncontrolled, left untreated, or just prolonged, and diabetes.
Right.
And then renal cell, wait a minute, one more thing. Renal cell carcinoma, someone asked about renal cell carcinoma in particular. Renal cell carcinoma is a type of renal cancer. It's a type of renal cancer that occurs in a particular lining of the kidney. It's more common in men, more prevalent in older people. So there are different types of kidney cancer. You even have a congenital kidney cancer, nephroblastoma, that you see in babies. But it depends on renal cell carcinoma is just one particular type of kidney cancer.
Exactly. And that's why I wanted to show you the different stages. There's so many different kinds. And you got stage 1 through 5. When you get to 5, that's renal failure or kidney disease failure. Whatever
You can have ARF. You can have acute renal failure. You can have chronic kidney disease. CKD is chronic kidney disease. ARF is acute renal failure, which is sometimes can be caused by medication, be caused by dehydration, be caused by a diabetic coma, and a number of reasons. And that's why, like, when those people are in the hospital, you see them monitoring their BUN, their blood urea nitrate, nitrogen, to see what those numbers look like in the creatinine. And sometimes they do actually, it does improve before those people leave the hospital.
All right. Thank you so much for adding to the series. Thank you. Okay. A good picture of, and you see some of these kidney stones are pretty big, and they're just like what the young lady just said. The kidney stones can be small, they can break up, and you can pass them. But if they're too large to go through your urethra and your bladder, and you may have to have surgery, because some people just can't deal with the pain. Okay, kidney stones are also called renal failure, are hard deposits made of minerals and salts that form inside the kidneys. Diet and exercise are part of that. Okay. So,
Tyrone, I have a question.
sure.
Because I've got to run to another meeting. But
Okay.
how common is it to live with one kidney? What's if you know the rate of people in this country living with one kidney?
It's not a lot. I really don't know the exact percentage of it. I'll be honest with you. But I'll find out for you, Alicia. But normally people that have, if one kidney failure, if somebody has a donor, a close donor relative, they can have a transplant. I know this. One of my relatives had the same problem. Her kidney was down to functioning only at what they call at 20%. So, and so she eventually got a kidney transplant. Now her father, my uncle, he went through dialysis. He was on dialysis for 10 years, but he was up in age, so that's probably, yeah. But his daughter was much younger, and they checked her to see. They checked her to see if she had problems, and found out that her kidneys were also not only functioning at about 20%. So she ended up having a kidney transplant. But with that transplant, as you said, she'll probably be on medication for the rest of her life, because anytime you get a transplant, that's usually what happens. Yeah.
Okay.
The person that's talking, can she clarify? Are you asking what's the percentage of people that live with one functioning kidney or one kidney only? One
functioning kidney.
One functioning kidney. Okay, not people who are
functioning. Yes.
Oh, no. Because some people are born with no kidney. It's about 1 in 1,000 people are born with only one kidney. So that's why I was trying to see where you mean, like, where one stops functioning. Most people can function with one kidney, provided that if you are at risk of diabetes or hypertension and you're functioning with one kidney, you got a problem, because the chances of you blowing that kidney out are going to be relatively high.
Exactly.
Unless you intervene. But the average person can live with only one kidney just fine. Your other kidney is going to enlarge, and it's going to compensate for the one that's missing.
But Alicia,
Mr. Tavo,
you wanted wait a minute, Alicia, you wanted to know the number of people that are living with one kidney or one function have not had a kidney transplant. I really don't. Yeah. I will find out a percentage.
If you had access, now that's not really that very, very much important to me. My question leads to the importance of, if you only have one functioning kidney, and that has just been addressed. But if you have high blood pressure and diabetes, that one kidney will have an overload. So I've got my question answered.
Okay.
Thank you very much. Okay.
You're quite welcome.
Yeah.
We have some smart people always on my classes. But go ahead.
Okay, Doctor.
Miss Qualls.
Dr. Qualls, thank you.
You're welcome.
I was just going to say that's why people can donate a kidney, like if they're compatible with their person that they're donating to, because you can live, if you're healthy, you can live with one kidney. So that's another factor. But you can't really donate if you're not healthy. If you have things like diabetes and all that going on in your own body, you're not healthy enough to donate to anyone.
No.
But they donate with impending problems, which is my issue, is if you see that this person is going down this path, why are you allowing them to donate? Because I've seen patients where their kidney was in another family member who had failed, and now their kidneys are failing. I've seen that multiple times. They don't have, because they gave it to somebody and they didn't do what they needed to do. And guess what? Wow. So now 10 years later, you have, you had diabetes, you have hypertension, and your kidneys are no longer functioning, but your other kidney is sitting inside of your brother and it's no longer functioning either. So now the two of you
know that? Did they know it before they donated? Or it's
Oh, I
something
mean, but
happened that-
what I'm saying is you can donate with hypertension. They'll let you donate with hypertension. My issue is the only time they really stop you from donating is if there's like scarring in the kidney, which you know you can't put that in another person, or at least America doesn't put it in another person. But yeah, to me, if you see this person is obese, you see this person has hypertension, why are we letting them donate when we know that they're probably going to need their own kidney at some point? But there's no guidelines for that.
Well, that's what I'm saying. I don't know.
No, it doesn't make any sense.
Yeah, if your kidney is going bad and somebody's donating to you, both of you, the recipient and the donor, you really need to change your lifestyle and try to reduce all of those functions, your high blood pressure, because if you don't, because you can get type 2 diabetes and, later on in your life, and if that comes up, the hypertension. So that's why I'm pushing a plant-based life or much healthier eating habits. Stay away from the sodas, stay away from dairy, all that stuff. If you are,
that means the cheese too, huh?
Oh yeah, absolutely. Did you miss my last one on we talked about crack?
I couldn't get in on the last one, but I remember before.
Okay.
but I'm curious now. The lady said people are born without kidneys. What happens to them?
Well, she said
they're born with one kidney.
Only one kidney.
Yeah,
they're healthy. They're healthy.
Oh yeah, most of them are okay. Like I said, the other kidney is going to enlarge and start to compensate for the other one.
Okay. So you did not say you did not say born without any kidney. That's not what you said.
Oh, no. If you're born without any kidneys, you're not gonna make it long.
You're not gonna make it.
Okay. Don't even get to taste the cheese. I'm messing with you, sir.
But Mr. Tyrone, you talked about food, and you remember it's not just because there are vegetables that lead to kidney stones too. You have the oxalates in beets, you have the oxalates in spinach and kale. So, I mean, we can't just say, okay, go into eating vegetables, because there are some people who are prone to kidney stones and they should not be consuming a lot of spinach, a lot of beets, a lot of kale, particularly raw.
No, you stole my thunder later on. I was going to talk about it, but there are a lot of, they're right, and you're absolutely right. Good.
Now wait a minute, I didn't know that because we were told to eat the spinach, the kale, and the beets.
Well, but what she's saying is that you just have to be real careful if for some healthy foods can lead to kidney stones.
But if I was eating them every day, because I thought that's what we're supposed to eat every day, kale and beets and spinach, because that's what we were putting in the smoothie. So this is
it's not going to affect everybody.
You either want to eat that or say that.
Is it because it's too much? Because I always thought that like a certain amount is okay, unless it's like
putting a bunch there, but I'm eating it like you said. You put that in your smoothie every day.
How do you know if you're prone to it? So how do you know what's too much? Too much is subjective.
Now my dad died of kidney cancer.
Yeah,
I haven't had any problems.
I will be honest with you. I make smoothies and fresh juices. I don't juice any dark greens. If I'm going to if I'm going to eat dark greens, I'm eating them. I'm generally going to eat them sauteed. I'm going to eat them lightly steamed. I very rarely eat raw kale or spinach or anything like that because of the oxalates. For some people, they're more prone to kidney stones, but you don't necessarily know. So to me, it's better to err on the side of caution than to, have you land yourself in the emergency room at 3:30 in the morning because you now have a kidney stone.
Are you a doctor?
I am not. I am diagnostic medicine. So I'm the first person to see the kidney stones.
You had kidney stone?
No, I'm the first person that they come see to see the kidney stone. I'm the one that finds the kidney stone.
Oh, you're not a doctor.
I am not a doctor. Diagnostic imaging.
Okay,
diagnostic imaging.
So I'm gonna let you finish, Mr. Pauls, but if you were on an island and had nothing else to eat. I mean, you can't tell everybody the same. Everything doesn't go with everybody.
Right.
Because it might not
That's
work.
why I said, don't just say eat vegetables.
No,
So-
there are a lot of people that can't eat. It's just like some people are prone to, like I say, green leafy vegetables. Some people can't absorb vitamin K very well, and so they can't eat green leafy vegetables. They got to be very careful about it. So when I say a plant-based diet, you still got to adapt it to you and your circumstances. There's no one size fits all for anything. You got to be careful. But I can say this: the probability of you having a bad diet increases more so than you having a healthy diet.
Right.
Well,
Yeah.
I got a report. This is a true confession.
Okay.
The first round with Tyrone,
It's not going through.
and my diet and my cholesterol. Then I decided, I can eat a little meat here and there. I can eat a little meat here and there. And it went up. Then she told me if it goes up anymore, you're going to get put on some metformin and cholesterol medicine. And I remember Tyrone. I said, oh, no, I'm not. So I went 6 months plant-based. I didn't do chicken. I didn't do anything but fish. I didn't do no red meat. My cholesterol went down and my and my A1C went down. So I'm a believer now, Tyrone. I mean, June 1st is when I got my results. And I made some spaghetti and turkey for somebody. I mean, the guy wanted it. His wife just died. I just made that for him. It wasn't the time to preach to him. I just cooked for him. I didn't even eat it. But so I converted y'all and convinced.
Well, I'm glad that it's working for you. But there's nothing that's I guess that fits all circumstances. Some people really have to be careful. Some people, just like in most cases, most people can drink almond milk. But if you have a peanut allergy, you can't drink almond milk. You shouldn't be drinking almond milk. But those are the kind of things that you should, you got to relate to. That's why I'm always saying you got to do your research. You got to think, but you got to look at yourself and see what works for you. If I make my smoothies, but I have grandchildren that have peanut allergies, so I don't make my smoothies with almond milk. I'll make it with oat milk or some other kind of milk other than almond milk or any one of the nuts. In most cases, I don't even use coconut milk, but one of them I know can stand coconut milk. But those are the kind of things you got to just be careful about. Okay, good conversation, good questions. All right, let's go back. Pardon me. Okay, symptoms of kidney stones. Stomach pain, backache, vomiting, dizziness, fever, and blood in urine. And we already talked about this excruciating pain. A kidney stone usually will not cause symptoms until it moves around within the kidney or passes into one of your urethras. Your urethra are tubes that connect the kidneys to the bladder. And we show that right here. That's where the kidney stone normally is. Okay. So, if a kidney stone becomes large in your urethra, it may block the flow of urine and cause the kidney to swell and the urethra to spasm, which can be very painful. At the point, you may experience these symptoms. So again, you just got to be real careful about, if you get a kidney stone. But the idea is to try to prevent it from happening.
Mr. Tyrone, you're talking about the ureter. if it gets lodged in the ureter. The ureter is that tube. The urethra is the hole that's just above the, your vagina or under clitoris. So it gets lodged in the ureter, not the urethra.
Yeah, thank you. Thank you for correcting that. I appreciate you. Types of kidney stones. These are some of what it looks like. Yeah, kidney stones, most kidney stones are calcium stones, as it shows here. Excuse me. And usually the form of calcium oxide. Oxalate is a substance made daily by liver and a substance absorbed from your diet. Your uric acid stone. Uric acid stones can form in people who lose too much fluid because of chronic diarrhea or those who eat high meat protein diets. All right. Other kinds of stones. All of these stones have significant properties, and you just have to be real careful about all the different kinds of stones that you can get. And as the young lady said, our expert nurse that's on, you got to be real careful about even some of the food. But unless you know what, your body, then you want to still try to eat with a plant-based diet. That's much better. But if you, depending on, now I've been doing smoothies for 25 years, and I always add collard greens, spinach, kale, everything to mine. So and same thing for my wife. She hasn't been doing it for 20 years, but she's been doing it for a long time. So it doesn't bother. So far, it hasn't bothered either one of us. But and a lot of people, I know a lot of people cannot eat certain foods because of their body cannot tolerate it. So you got to find out. But again, it's better to go plant-based and figure out which foods work better for you than to eat that junk that comes from McDonald's and Kentucky Fried and dairy.
Mr. Tyrone, may I say something?
Sure, absolutely.
Two pages back, when y'all was talking about dialysis, about kidney transplant.
Mm-hmm.
My husband, he have a set of twin brothers, and they was born with bad kidneys. He gave one twin a kidney, Donald, and his sister gave Ronald a kidney. And this was back in 2002. So he's still living on one kidney. Now, this is the kicker. I don't know how true it is, but my husband gave it, like I said, gave Donald the kidney. He never drank or smoked or none of that. But my husband likes his Budweiser. So now his brother have to keep a 6-pack of beer in the refrigerator. He have a taste for it every now and then. So I'm assuming he got the beer kidney. But okay. he never drink, but he every now and then he have a taste for a beer. But he's still living, both of them.
Well,
so they can live, afterwards. Yeah.
Okay. Thank you for that, Marilyn. We appreciate that. Very good.
All right.
Okay.
Tyrone.
Yes, Doris. Hello. How are you?
Okay. How are you?
Absolutely.
talk about sodas. I thought the diet soda was okay.
No, well, in terms of kidding, diet sodas have artificial sweeteners in it,
Right,
like aspartame, and
right.
and the jury is still out whether those artificial sweeteners can cause cancers. But you still and aspartame artificial sweeteners are all you doing is still satisfying that sugar addiction that you have because artificial sweeteners. Hold on, artificial sweeteners are 2, 3, 4, or 500 times sweeter than sugar. They just don't have the calories. So what you got to be careful of. So to me, diet sodas are worse than regular sodas.
Okay.
Yeah,
I just
because
read
they
about
cause,
that yesterday.
Yeah.
Miss Doris, because they cause weight gain and cardiac. They mess with
No.
diet sodas, mess with the heart too.
Yeah, but yeah, what they don't know all the things that artificial sweeteners do, and that's I'm just not a big fan of putting a whole lot of artificial stuff in my body or anybody's body, or because if you if you're using aspartame and so many soda manufacturers use that, and that is to cut down on the calories. Because I know when I was working for American Diabetes Association, and that was years ago, they talked about switching from regular sodas to diet sodas because the calories.
Mm.
But they really didn't look in it. You still had that addiction to sodas because your addiction is to sugar, and if you aspartame is, I think, 400 or 500 times sweeter than sugar. So you got to be just real careful about drinking sodas or diet sodas. If I were you, I'd try to eliminate them altogether out of my diet.
Well, I'm not going to buy anymore, but I don't drink any dark sodas. I just drink ginger ale, and I usually do it like every other day. The No Zero, because I drink a lot of water, because of the fact that I had been given a bad blood and I had hepatitis C. So I drink almost 100 ounces of water a day. So it's like a dessert for me.
Okay.
Sodas, but this is the second time I have read something up about the diet soda. So
Okay.
it'll be
Darsh,
the best that I have.
Darsh, you're looking great. Actually, you lost some weight.
51 pounds.
All right. Congratulations to Doris. Yes,
Yeah.
you look like you're about 50 years old.
Oh yeah, right. I'll be 88 in 2 months. 2 months, I'll be 88.
Yeah, you don't look it, baby. That's good. I'm so proud of you. Congratulations.
And I'm proud that you were my instructor. And I talk about you, all the time.
Yeah, my ears are burning all the time. All right.
Your wife, tell I said hi.
I will. She's right here. She's on. Yeah.
Oh, is she?
Yeah, she's on the Veronica.
Oh, hey, how you doing?
Okay, darling.
All right, let's get into this
I
study.
just had this salad.
Oh, wow. Okay. A new study published by the National Kidney Foundation, American Journal of Kidney Disease, provides new insight into the role of the management of prevention. Let me say that again. Provides new insights into the role and management and prevention of chronic diseases, adherence to plant-based diets, and risk of chronic disease progression and all-cause mortality. And that is by Dr. Casey Reibesich, one of those names, from the Department of Hepatology, at Johns Hopkins Bloomberg School of Public Health. So they are starting to do research to find out that plant-based diet is much better for people that have kidney disease and prevention of it. But again, like the young lady said, you gotta be careful about still what you can eat because of kidney stones. So, but but kidneys, in most cases, kidney stones are not high in the mortality rate. They'll be very painful, but in most cases, you either pass them or you have the surgery to take them out, and that's not a problem. So, but a lot of these other diseases and kidney failure or renal failure can be a really serious problem for you, even though you have two of them. But other things like breast cancer, prostate cancer, all these other cancers, if you're not eating a plant-based diet. So plant-based diet is starting to gain a lot of traction in the medical industry, and try to switch people to that versus being a vegan or being a vegetarian.
What do you avoid in using a plant-based? What do you avoid that you don't eat?
For me, well, there are different times. My holistic doctor told me, because I was having some pain in my shoulder, excuse me, pain in my shoulder, and he told me to stop eating white potatoes. Make sure I didn't eat anything for potatoes. Once I took potatoes out of my I don't eat a lot of potatoes or even potato chips. And even Levon, are you still on?
Yes, I'm still here.
All right. You mind telling your story about when I told you about potatoes and your I think it was your knees that was the problem?
Right. My knees were inflamed. And in one of our classes, you were talking about how you had stopped eating potato chips because we both buy the same kind, the avocado chips.
Right.
And you had talked about, yes. And I said, I eat those too. And I usually put them in like the little baggies. I try to divide them up like 16 chips in each bag, but I still would eat like maybe 4 or 5 bags a day. And the inflammation in my knees were horrible. So when you said that, I had stopped eating the potato chips, and sure enough, the inflammation in my knees went away. I didn't, right, because, and then I gave up white potatoes. I started eating red potatoes, and for some reason that seemed to be better. But after I gave up the potatoes and the tomatoes, then the inflammation in my knees went away.
Okay. See,
Yeah.
and those are the kind of stories that happen, because most people, I mean, you would have, I know white potatoes are not necessarily good for you because of the starch and the high glycemic index on it for a diabetic. But but I do eat. I try to buy now you can buy a bag of purple potatoes. I found at Lidl, the store, you can get just like you get a bag of sweet potatoes, you can get a bag of purple potatoes, and they're a whole lot better for you, and yams and sweet potatoes. So
Can I add something?
Sure, go ahead. Absolutely.
Oh, I'm sorry. And I just wanted to say that the plant-based diet does help, because I was able to get off my blood pressure medication after being on that diet for almost a whole year. I had to gradually change, but I was able to get off my blood pressure medicine, and everything's been pretty good.
All right. Congratulations.
Yeah, thanks to you. Thank you.
Did you go total plant? And because I'm still eating some fish, so I'm trying to get there. Did you go total plant?
No, I did not. I still eat fish. I still ate fish, and I still used to eat baked chicken, but gradually I gave up most of the meat and started eating most of the vegetables and fruit. So my knees are doing pretty good, and I haven't had to go back on my blood pressure medicine, so this is good.
Well, that's what I'm shooting for, and I'm trying to not eat as much fish, and I'm not. I'll tell you a quick tip I figured out was to put like a cup of brown rice in my salads, and that started making me feel full. So
it takes time.
What Miss Wright, what kind of fish do you eat?
I got rid of the farm raised because of that TV show. So I'm doing cod and salmon, and I will do on a snack a can of sardines. That's my like go-to when I'm cooking.
Okay. All right.
I'll do sea bass, and that's about. I did try. I don't do catfish once I found out I can't get anything but farm raised. So any wild caught white fish.
Okay. Yeah,
that is excellent for you.
But it's hard because I'm tired of eating the fish because they say that's high in mercury. So now I'm trying to not eat as
it more than likely it's going to be high in mercury if it's farm raised. If it's wild caught, the chance, I'm not going to say it doesn't have any mercury in it, but you can look up, and that particular kind of fish, you can do the research and see what's the probability of cod or whatever salmon, wild caught salmon from Alaska. What's the probability of mercury being in those? Yeah. So it's not that bad in most cases. So,
but it's working. I'm like Levon. My numbers went down because I stopped worrying about weight, which it did come down to. And I said, I'm on my numbers because those numbers is what put you on them pills. Because I wasn't gonna be stupid, like it runs my family, and if I had high A1C, you don't want the negative effect. I said, but I'm gonna be dang if I'm gonna be on pills and gotta curb my diet. I said, let me do this diet thing first. And one thing about my doctor I liked, she said, fine. She said, you'll come to me when you're ready. She didn't like push it, she said, and she tested my blood too, because I was worried about what am I missing in my blood if I don't eat red meat? I know you told us, Tyrone, but I still wanted to check to make sure my blood.
No.
You hear the other, people that needed B something, B6, 12, whatever. You could have a deficiency if you didn't. Like you say, that last class you had, it just enlightened me so much on what the USDA say we're supposed to have versus what we really need. So keep up the good work, Mr. Qualls, because I'm telling you, there's so much we don't know.
Yeah. Well, the more I read and the more I do research, and it's just so important because my aim is not to be your doctor, but to enlighten you to the kinds of foods that you can and do prevention. You can prevent so many if you change your diet. So that's the main thing.
It's real. It's the hardest thing because we're in our 60s trying to eat different and wait.
Yes.
You say, dang, I gotta wait till my 60s when I can afford to buy me some and all of that, and I'm not supposed to eat it. And on the real, after a while, you really don't miss it.
No, and
you really think you're gonna miss it. So I gotta tell. I said, all right, 6 months, got good results. I'm gonna get me that key lime pie. Didn't realize it had all that dairy in it. Baby, I was so sick the next day. I said, well, you don't have to worry about me eating that again. That won't be a reward. My stomach did not like it. No. I had diarrhea. I was throwing up on something that I used to eat.
That's what happened to me when I ate something that had dairy, like when some desserts that you think, okay, you're not sure, and you say, you get tempted. and then you feel it afterwards. You know what I mean? Like, so I don't know. I can't remember it was just like kind of like tart or something. And I was like, I bet you it has dairy in it. But
Mary, why don't you, if you don't mind sharing with them your weight loss story?
Yeah, so my weight loss, I took Mr. Tyrone's Natural Diabetes Prevention class in 2021. And it was after I was diagnosed with breast cancer. And I just wanted to do something to change my lifestyle, my eating, and prevent it from returning. And like I went every Thursday for a year. I think I just missed one class, and I lost 50 pounds. Like I practiced thank you. I practiced all the tools that he taught about, the stretching in the morning, the glass of water in the morning, the plant-based, avoiding dairy and meat, and like you said, Miss Wright, you don't miss it. It just becomes a part of you that you don't miss it. And if you do say, how some people will like, oh, here you go as a gift, they give, something that like you have a feeling has dairy and you try it, you feel it. Oh my gosh. I'm like, I'm never doing this again. I just say, I'm on a diet. Or I just say, I'm trying to watch my weight or something, so they know. But yeah, it works. The plant-based diet really works. Like I feel healthier, I just feel more energy, mental health wise, I feel good. I feel healthier now than I did when I was in my 20s and teens.
Oh, wow. Let me
unlike those infomercials, we ain't not being paid for all of y'all that's listening.
No.
I'm telling you,
right.
Did it, stopped it, went bad, then came back to see the light, and the numbers went back down. So they went up and they went back down. I think that's the point I'm trying to make. They were down when he told me. Then I got grown, thought I could, eat my little chicken and stuff. I still didn't eat a lot of red meat, but I didn't commit. Now, what I didn't do, Tyrone, is I had not committed to the dairy.
Right. I remember.
I committed to the dairy, and so I said, January, you got to see this woman in June. You are not taking no pills. Tyrone said, we don't have to take them pills. It's not hereditary. I mean, everybody in my family got it. And I said, And I'm going to do even more. I'm going to tighten up some more. I'm convinced. I mean, I know some of y'all are sitting there going, and he said that cheese is crack. But once you stop it, I don't do the eggs now. And I didn't think I could go without my eggs now. But I don't do the eggs. If I do plant-based and make an omelet out of it. I try not to do a lot of that Beyond or Impossible meat because it's high in fat. But I will supplement it, with the fish here and there. Because I can make some mean meatloaf out of it. And I even use the plant-based egg to hold it together, as they say. That stuff was slamming.
All right. Well, since she won't do it, I'm going to brag on Mary a little bit. She talked about the weightless dog. Now, Mary invited me to participate and be a speaker for her church, but that wasn't the amazing part by any means. The amazing part, Mary did the presentation herself. She is now not the student, but she is the teacher now, and she did an absolute fantastic job. I mean, she talked about the plant-based diet, and she just hit that home run and knocked it right out of the ballpark, and I was just so proud of her. So
thank you so much.
Yeah. But you did it. I just try to give people the information, and she did what I always like, and I know quite a few of you, the rest of you are doing. You're doing your own research. You're looking at what plant-based can do for you. You're figuring out that it must be better. You're not doing the dairy. You're not doing a whole lot. You're not doing sodas. So you're not eating the same way you do it. And I know it's difficult, like as Ms. Wright and Dara said, you know, the older we get or the more mature we get, it's hard to make, you know, lifestyle changes after you've been eating the same thing pretty much for 20, 30, 40, 50 years. But y'all are proof that it does work. And that's what I'm so proud of you for. Okay, well, this is going back to the food. This is a salad for a good plant-based diet, and say, and the Kidney Foundation is starting to look at, you know, how to prevent and recommend a plant-based diet for those that are dealing that have kidney disease, a chronic kidney disease. So, you know, take heed. Okay. I'm going to show you this. This is my go-to book for plant-based cookbook. I bought this off of Amazon. It's in red. Up there, it's called American Test Kitchen. That's where it came from. But you can buy the book on Amazon. But down here it says 500 inspired flexible recipes for eating well without meat. For all of some people will say, well, you tell me I can't eat all this stuff. Well, what can I eat? There are 500 recipes in there. And they go to soups, they go to salads, they even have desserts. They have all different kinds for whatever you're looking for, casseroles, all different kinds of plant-based foods in there. And in the beginning of the book, it gives you a little bit of history about what plant-based, and talks about different milks, talks about different grains. So it educates you also. So, but this is just the one that I use. You can look up one. You can look them up on Google and find one that is, you know, appropriate for you. And a lot of the books now. I have another book. This is Vegetation Over Medication, Dr. Bobby Price. And my wife turned me on to this one and onto him, and he's on YouTube also, and he's a pharmacist doctor, and he talked about what he's doing. Now, I told y'all I was going to tell you about my other book. I haven't gotten to it, but The Cheese Trap. This is breaking. If you want to learn about cheese, breaking a surprising addiction will help you lose weight, gain energy, and get healthy. And this is by Dr. Neil Barnard. And he talks about cheese as crack. All right. But I bought my book, and the name of the book is Lies That They Taught Me in Medical School. And this is a professor at USC and UCLA, their medical schools, and he's a professor, and he teaches medicine. He was diagnosed with prediabetes, high blood pressure, high cholesterol. They wanted to put him on all kinds of medication that doctors normally do. He started doing the research, and he found out that he can control all of the chronic conditions that he had by changing to a plant-based diet and changing his lifestyle. And that's why he's saying he's been teaching lies in medical school. And that's why the system is broken. The system is a problem. The system is racist towards us, people of color. So we got to be real. You got to understand that we all on in the white supremacy racism system, and we, you know, and if we don't make sure Donald Trump doesn't get elected, it's going to get worse, because now the Supreme Court, because whoever is the next president is going to be able to probably put 2 or more people on the Supreme Court, and that Thomas and Alito are in their mid to 70s, so they probably maybe retire after when they get close to 80, hopefully, and the next president may be able to, name 2 more Chief Justice, or I'm not Chief Justice, but Justice to the Supreme Court. So we got to make sure that Donald Trump does not get elected. Okay. Anybody have any questions? These are some reference books. This is the information, and all of you that have donated to my effort, I really appreciate you always. Thank you so much for those, from small donations to whatever size it goes up to. But also, you could, we're recording it now on YouTube. I am working on starting to look at doing a podcast. I have the software, and I'm starting to work on. I'm going through a learning curve, to try to learn how to do a podcast. So I'll keep you informed about it if I decide to do one. Let me back up. I am going to do one. I just haven't decided when I'm going to do it yet. But I have my son. We have 2 sons. Craig that was on here earlier. He's my quasi son by another mother and another father. But he's helping me out. So from a technical standpoint, but I'm going to do a podcast at some point in time this year. I just haven't, but give me time to work on it. But I will let you know. And I just want to try to get the information out to more people. So all of you, I thank you for donating to the cause. I appreciate all of you. Is there any questions that we have before we leave? Anybody? Go ahead, Mary.
Thank you. Just want to know, so you say the white potatoes are the ones that we should avoid, but like purple potatoes and any other color is better?
Yeah. No, sweet potatoes or yams, same difference.
Okay.
Yeah, but you can get purple potatoes, and they're purple on the outside and purple on the inside. Sometimes they call them Korean potatoes. That's the official name, but I just call them purple. And you cook them just like you do yams, and they are absolutely delicious. I put plant-based butter on them. And put some seasoning like Mrs. Dash on it. They're absolutely fantastic. And if you want to eat the skin, it's okay, because the skin has a lot of nutrients in it also.
Okay, it's just the white potatoes that are the ones that we should.
White potatoes are the problems, and they're loaded with starch, and for me, it started causing pain. For some people, it just puts weight on them, but it also can cause other problems. But there's no, as I said before, there's no one thing that fits all sizes or which you eat. The potatoes, I hadn't even thought about the potatoes, because I was eating, as I said, I found out about these avocado potato chips cooked in avocado oil, and that's what LaVon was talking about. And they were at Wegmans, So I looked them up and they were low in sodium. And I said, okay, maybe not a bad snack. But when I went to my holistic doctor and he said, well, because when I lay on my side, my shoulder would hurt. But if I'm standing up, work around, my shoulders didn't bother me. And I kept saying, well, what's going on? And it was a lot of pain in my shoulder. And when I went to see my holistic doctor, he said, stay away from white potatoes. I stayed away from them. Pain was going away.
And most MDs can't tell you that. They can't pick out what's
no.
His method.
Hey, sweetheart, let me call you right back. I'm on a Zoom call.
Anyway, but yeah, his method is so awesome. You just be mesmerized. You know, with what he does with his things and his tubes and his wand, and he can just tell you right off what it is. MDs don't know that. And Tyrone had everybody else confessing tonight. Y'all should make him confess that, like, we've been together since 2018, connected by the hip. But when he was first invited to my home, he saw some Cokes and Pepsis on my floor, didn't you, baby? Well, I guess he knew not to really it, but, you know, because we weren't, you know, totally in there yet. But, and he hasn't confessed that I was so head over heels over him that I went just cold turkey with most things. Didn't I, baby? I just whole stuff. I'm not doing this no more. I'm not cold turkey. Because I was heads over heels over him.
and her sarcoidosis is close to being in remission.
Oh my!
That's wonderful.
Yeah.
Yeah, the holistic doctor told me everything, what not to eat, what not to do. You know, it's just amazing. I don't have half the stuff, not even, I mean, a quarter of the stuff going on that I used to have. Oh my goodness. And
what about the new vaccines?
I'm on the not on the committee, but I joined the Johns Hopkins sarcoidosis I want to call it telecast, whatever we have on Zoom, every third of the month. And most of the patients either don't look well, and I'm trying to tell them, you know, but I'm not my husband, but I can repeat most of the things that Tyrone tells us or tells y'all, you know, and I try to tell them, stay away from dairy products. Some people will listen, some people won't. Stay away from most meats, you know, the red meats and all that stuff. But yeah, most of them are still dependent on that, especially that prednisone. They are just, some people just don't believe.
Yeah. And when her doctor took her off, I think you were on prednisone for about 30 years before.
Oh my goodness, yes.
Yeah,
I was diagnosed in 1990, so I had been taking it for quite some time.
Right. And but I didn't take her, you know, I didn't suggest that she take off. My job was to improve her numbers and her scans, her PET scans that she gets. So the doctor, her sarcoidosis doctor at Johns Hopkins, took her off prednisone because her numbers were starting to it. She used to get infusions every 6 months. They would send a nurse over to our house. Yeah. And they would, and for about 4 or 5 hours, she would get an infusion of anti-inflammatory medication.
Because my system was so inflamed.
Right.
Oh, I used to cry myself to sleep some nights, most nights.
Now she hadn't done that in a couple of years now.
That's great.
Yeah.
What a blessing.
Yeah.
What a blessing.
Well,
yeah,
see,
I love that I love that she saw you as someone that could actually help to change, because honestly, it is very difficult to be in a relationship with someone who does not take good care of their health, and it can actually ruin a relationship. There's, you know, so many. It's harder to get men to follow than it is to get women to follow.
It is. No, I totally agree with you.
And women tend to be more of the caregivers. And I mean, we constantly see patients that just will not cooperate.
Right.
And if one party in that relationship is taking care of themselves and the other part is not, well, that partner now has to become a caregiver when something happens. Now, granted, anything could happen, but don't increase your chances, because you can now ruin your partner's health, because your health they now have to take care of you. Now, most caregivers generally end up with some type of health problems because they neglect themselves trying to care for another person. So it's always a good thing when two people can be on one accord. And then you encourage that person to do their own research, because you never want somebody to compromise who they are and try to be what you want them to be, because the resentment will set in. But it's very important when they say equally yoked, it's more than just religion. It's so much more to that.
Yes.
Yeah.
Well, I am, I've been asked to do a caregivers conference. I'm the keynote speaker coming up in September. But this is for Prince George's County Department of Aging. And the young lady invited me to come in and to talk to naturally caregivers, because as you said, caregivers end up being sick because they don't adhere to the airplane theory. And the airplane theory is you got to put the mask on you first. And they're so busy taking care of somebody else in their family, or they do it for a living, that they don't take care of themselves.
Yeah. I mean, I see patients all day. When I get home, I don't want to deal with a spouse who I know it sounds awful, but I'm serious. I deal with patients all day, non-compliant, coddling patients all day. When I get home, I do not want to have to care for a spouse too. And it sounds cruel to some people, but it wears you out. I'm not willing to compromise my health for another human being. So if we really are, feeling each other and love each other, shouldn't we try our hardest to be there with each other for as long as we can, with a quality of life, not simply a quantity of life where that person is changing diapers and, going back and forth to appointments, a quality of life together.
Yes, that's the key. Everybody's going to die, but the quality of the years that you have left is important to most people. No pains, no chronic conditions, and if you're going to die, you die of natural causes. But go ahead.
I want to close with this. I talk to people often, and they say, "Well, you have to die of something," and I say, "Yeah. Do you sleep with a prostitute without a condom on?" And they said, "No." I said, "Why not?" Because you might get something. You're probably going to get something. So then why are we so lackadaisical with our health and our bodies? You are going to eat the chips, drink the sodas, eat at Chick-fil-A because we all have to die of something. If that's the case, go sleep with the prostitute with no condom on. Go swim in the harbor. Go swim in the Potomac River. You might not get anything. You may or may not. We're
I'm going to use that. I like that. That's a good one.
We're more logical with everything else except for our health. Well, something's got to kill you, or the other one is moderation. I get so tired of hearing them. What is moderation? It's subjective. You don't tell a drug addict, "Oh, we'll just use heroin in moderation." Only when it comes to food do we say that.
I know. And I'm the same way. People say, "Well, is moderation okay?" I said, "Look, moderation is not all it cracked up to be. Don't do that. There are certain things that you can do in moderation. It's not a blanket, if you're going to use it as a blanket statement, "Oh, I can eat what I want as long as I do it in moderation." That's excuse my language, that's bull crap. You cannot eat what you want and still do it in moderation.
Yeah, it has to be elimination. You have to change your desire, change the palate. So change it so that you don't have the palate for sugar. Change it so
Exactly.
you don't have the palate for Mountain Dew. Change it so you can get out of that darn Chick-fil-A line that's always got a minimum of, I'm always looking at the line. I said, it's always a minimum of 22 people in that line.
Yes. And they had double lines. All Chick-fil-A.
Double lines. If I see Chick-fil-A with 5 or 6 cars, I tell my mom, I said, wow, Chick-fil-A was not busy today. Six people only. Even during this pandemic, the line was, I said, do y'all know the Polynesian sauce is crack? It's got so much high fructose corn syrup in it, the vanilla, the fries, the chicken, all that stuff is crack. That's why you can't get out of that line.
No. The people just don't understand those addictions. Yep. So, all right, people.
Well, Tyrone, I just
Yes.
want you know, Charlie is drinking almond milk now.
All right. And I know that was a journey.
Yes, it was a big journey. I am so proud of him.
Yeah.
Listen, can you, before you get off, what about tomatoes, bananas? He's taking me off of that nephrologist.
Well, tomatoes are part of what we call dark shades.
Right.
And for some people, tomatoes can be a problem. I know it. Our holistic doctor took my wife off of tomatoes for some time. So normally tomatoes are good, but for certain conditions, and if he's taking you off tomatoes, it's probably for a good reason. So
I told you we just got diagnosed with kidney disease.
Oh, okay, all right, okay.
So, and then this thing came out about cucumbers.
What did they say about cucumbers?
Not to eat them.
Why?
Well, see, again,
it just came off last week.
Yeah, I'm very reluctant to when they start talking about a blanket. Don't eat these things. You gotta look at the source. Where's that coming from? Because unless the cucumbers are the way that they are grown, there's something wrong with them. I use cucumbers all the time.
So do I.
I do too, because I eat a salad every day.
Yeah, what were you saying? I'm sorry, Ramona, what were you saying?
No, I was just asking Doris, why did they say don't eat cucumbers?
They didn't.
Okay.
Okay.
And they've closed down the market underneath the viaduct.
Oh.
They just did that. Our missionary president told us they just closed that.
The one under 83?
Yes.
They closed the whole. Right?
Yeah.
Wow.
The farmers
We have one right out here. We have.
You're talking about the farmers market?
Yeah.
No, I was that.
Did they say?
Did they say why it was closed?
Yeah, she said, because I was asking Audrey, because I wanted to go down and help, and she said they just closed it.
Well, does it close normally at this time, or why?
No, it's open. It's
No,
open.
it's always open during the summer.
Always. It starts in like the middle of April, all the way up until.
That's right.
I was there yesterday.
November.
It starts at 7. It closes at 12. I was there yesterday. It's not.
It was open yesterday.
Oh yeah. Okay. It's not. Yeah, and my question would be who said no cucumbers and not? Cucumbers it's actually a melon. It's not even it's a fruit.
Yeah, that's my question.
It's a fruit.
Why
do
we not eat cucumbers?
Yeah,
that's why I was asking you, because I figured maybe you had heard it.
No, I have not heard anything about, there are different times that if something gets contaminated coming from a particular farm, a manufacturer or something like, or a produce farmer, certain things like that may be happening. They're going to pull back on certain kind of, but their cucumbers, I think most of the cucumbers come from South America anyway. So I haven't heard that we shouldn't be eating cucumbers. That's you got to be real careful, because the the medical industry, puts out false information about healthy foods all the time. So you got to be real careful about. You got to ask who and what. It's just like dietitians and nutritionists. You got to ask, because dietitian and nutritionists, who their school, their accredited schools, who sponsors those? The meat industry, the dairy industry, they sponsor those schools. So they're going to, I've had a dietitian tell me, oh, it's okay. You should be, it's fine to drink whole milk because of the B12. You need the B12. No, you don't. I'm not saying you don't need the B12, but you don't need it from dairy. If you're gonna do a supplement, go to a nutritionist store and get the supplements. Don't go to, the five and dime store or
Walmart.
Walmart or something like that. Because you really don't, supplements are really not that good for you. But if you go to a nutritionist store, sometimes Chinese herbs that can't help you. And because one reason I'm not real fond of supplements, because supplements only take care of one thing. And that's not how your body works. If you were taking B12, vitamin D, or whatever vitamin, and that's the only vitamin you were taking, that's not how your body works. What I would do is, if the doctor says you are deficient in a particular vitamin, look and find out what vegetable is loaded with that vitamin. And I will start transitioning it to that. I'm not going to tell you not to take it, but try to find some natural way of getting it into your body instead of through a supplement.
And some vitamins need each other. They need other vitamins. You can't
exactly. Yeah.
If you in turmeric, you need black pepper to activate.
Yeah.
So there are certain calcium and magnesium. There's certain things that have to go together in order for your body to be able to process it. You need soluble vitamins. So just taking a supplement, and then often people try to take supplements in lieu of doing what they need to do altogether. Oh, can I just take this red rice yeast? No, you can't do that and drink Turkey Hill lemonade and Chick-fil-A. It's not going to work. It doesn't work like that.
No, she's exactly right. That's where your body is holistic. It works in conjunction with everything else. When you eat, let's say kale, spinach, something like that, if you look up what the vitamins and minerals that's in kale, there's a multitude of vitamins and minerals. Some vegetables have more of one vitamin or one mineral than another, but you need all of them, the whole rainbow of fruits and vegetables. There's no such thing as a superfood, because the creator did not make one particular food it covers everything. You got to eat all different kinds. That's why you want to eat different kinds of plants, different kinds of fruit. If there's some people that are allergic to fruit, they can't deal with the acidity that's in the orange, then don't eat it. Find something else. Some people can't eat certain other fruits. Okay. But find what you can eat. Don't say, well, I can't eat, since I can't eat fruit, I'm going to go, as the young lady said, I'm going to go to Chick-fil-A and have something from Chick-fil-A. No.
You have to do your own research. You have to be your own advocate, first of all, your own advocate in healthcare. But you have to do your own research. Dr. Sebi had one philosophy. I personally think that Dr. Sebi was extreme and not practical for the average person. Yeah. But he's also, he has had some success. Dr. Lustig has one. Bobby Price has one philosophy. Do your own research, but the biggest thing is know your own body, because if you try to just use one cookie cutter approach, you might be prone to something that that other person is not. And we're constantly looking for the easy way out. You got to get in here and do your own research and find out which one works for you. For one person, it may be a fruitarian diet. For one person, it may be some grass-fed, meat. For the next person, it may be a whole food plant-based. Do your own research and then find out what works for you, but be aware of your condition and your state before you try something.
I couldn't have said it better myself. With that, we're closed. Thank all of you. I'll see you in 2 weeks for the next one. I'll send out emails and let you know what I'm going to talk about next. And for Ms. Wright, I am going to within the next maybe in August, I'm going to get back to the white supremacy.
Well, you can get with us right before the election, so we can be fired up.
I'm gonna be fired up by that. Yeah, I'm going. I got so much research to do. I think I told you I have this doctor that she and her sister graduated from Harvard University, a Black female. She and her twin sister graduated from Harvard because their mother went to Harvard, but she's got a book and the book. Let me show you let me show you the book that she has. It's hard for you to see this, but it's called Legacy, and this is about her, how racist she found out that the medical industry is at Harvard University and through her practice and the information that they're telling you. So it's just so much, crap out there. We just got to find out. So.
Yep. Okay.
All right. Thank all of you. And again, thank you for the donations. I appreciate everybody. Love you. See you in 2.
All right. Good night, everyone.
Good night, everybody. Good night.
Thank you.
Good night.
Thank you.
Good night.